Welcome to Our Health Inheritance. I'm Liz, and thank you for joining to hear all about my reconstructive process. So, it started with genetic counseling, it then led to genetic testing, and the results were that I was positive for the breast cancer gene mutation BRCA2. I chose to do a prophylactic bilateral mastectomy and reconstruction. So, my previous posts take you through all of that. Here we are, post surgery. It is 2012, 13, and life is moving forward. Raising my child, living my life, all the things. And around through that time, along the way, I noticed that one of the implants was sort of like raising up gradually. And it happened, I would say, pretty quickly, where one was higher than the other. And the doctor said it was because the scar tissue from when I had to remove the tissue expander due to that infection I talked about, the scar tissue has caused more encapsulation on one side. And so it's almost like, you won't be able to see much here, but there's like a little ridge right here. The top of the implant sits right here. On this side, it's very flat. So the breast just lays as normal. On this side, it's like I have a push-up bra on. On this side, not so much. So they are uneven. And if I were to wear like a V-neck shirt, you would see that. No huge deal. It is what it is. I go through my life just fine. But it's always something, that I try to dress myself to maybe disguise that a little bit. Additionally, because years ago I think I mentioned this in one post, I had a breast reduction. That was back in maybe 2003. And so my skin already, because I had a breast reduction, my skin was already a little bit on the thin side. And then after the mastectomy, where they removed everything, including the skin that was my breast, along with the tissue and all the things, that left me very flat, right? Well, more concave than anything, with just skin, muscle, bone. And then they put the implant in after stretching the skin. So they stretched it with the tissue expanders that we talked about in a previous post, and then put in the implant where they had made room for it. Well, because the skin had to be stretched yet again, the skin is very thin. So another issue that I have, that is what it is that you will see parts of the implant through my skin. So if I were to wear a very thin shirt, you're going to see little nuances, little ridges, lumps, bumps along the breast. It's not a smooth surface. And so I always wear a tank top underneath everything. I can't really wear a bra very well because the implants just don't really sit well in the bra. It's not comfortable at all, and I don't need one. All I would be doing is just sort of the whole purpose would be to put a layer between my shirt and my skin, just so you don't see the bumps and lumps and whatnot. So that's just not something I do very often. But they will be having to replace my implants because over the last few years I've been feeling a lot of pain because they're becoming more encapsulated, especially the one particular side where all the scar tissue is, and the one that is raising up. So what happens when I feel these really sharp pains is I basically have to separate stop the encapsulation, because that feeling is that it's literally like pulling. I guess it's like a pulling feeling, pulling sensation. So it's as if the scar tissue is literally like grabbing a hold of me. And so like today I was at the store and this happened and I was getting some really sharp pains. So I kind of found a little corner where nobody was really paying attention, and I had to start punching, not really hard, but kind of roughly punching the breast and trying to detach the scar tissue. Essentially, that's what it feels like. It's just like grabbing a hold of me, and I have to break that up. So that's what I do. So if you happen to see someone in the corner at a store punching their breast, don't judge. Just understand there's probably some reason for it. I'm sure somebody noticed at some point through the day, because I had to do it a few times. But again, I try to be as inconspicuous as possible, but I really also don't really care that much if people see. So that's part of my life. It's an odd, interesting fact, but it's something I go through. So they said that my implants probably should have been replaced a while ago. I've had them for 16 years almost. Well, really more like 15 or 14 and a half, something like that. Because, gosh, yeah, let me think about that. Less than 14 and a half, probably more like 14 ish years. Because the surgery was 16 years ago, almost coming up on 16 years. And then the reconstruction was delayed because of my pregnancy and because of my infection and all the things. So yeah, then we had to do the whole tissue expander process, and then I got my implants. So honestly, I had so many surgeries because that reconstructive process was multiple surgeries. So I don't even remember when I had the last final reconstructive surgery. But essentially, the doctor said, yes, you're supposed to replace them after 10 years. Well, I wasn't going to do that unless I had to. I've been just tolerating the pain, and it doesn't happen all the time. It hit or miss. So I'm basically going to have to do it soon. Okay. But I have some other health things I'm facing and have had to face over the last couple years unrelated to this that have taken precedence. But the one thing we haven't talked a lot about is the fact that in addition to having a high chance of getting breast cancer, my risk of getting ovarian cancer is also elevated. So in order to prevent ovarian cancer, which is very hard to detect, now I have been doing proactive monitoring, a lot of ultrasounds and things like that, but it's really hard to diagnose. And so they recommended around the age of 40 that I remove my ovaries and fallopian tubes. They think that ovarian cancer actually starts in the fallopian tube and then eventually reaches the ovary. So removing both is what they recommend. I did wait a little after the age of 40 because I wanted to make sure I was done having children. And we were just blessed with one, and she's amazing, but we did not have a second. So when I realized, okay, I think this is it, we're just going to stick with the one child, I went ahead and scheduled surgery. Now that was in 2019, and it was December. Thank goodness I did it when I did, because once we entered 2020, it got real dicey, of course. It would have not been wise to go into surgery at that time through COVID, so I'm really glad I did it when I did. But by removing my ovaries and my fallopian tubes, that threw me into menopause. So, and earlier than, I would have gone into it. I hadn't even started perimenopause at that point. So with the natural menopause situation, you would normally have perimenopause where you would start to, enter gradually. And the whole menopause process can take years, many years sometimes. Everyone's different. But in my case, since they removed my ovaries and fallopian tubes, I was just thrown into it. So I immediately started having hot flashes and all the fun symptoms. It wasn't horrendous, I will tell you. They did tell me at the time, research showed that I was not a candidate for hormone replacement therapy, HRTs, because the belief or the studies were showing that it could cause breast cancer. So because I just had the mastectomy not that long before, they don't know if they got all of the breast tissue. There could be cells left behind. They didn't recommend that I did any hormone replacement therapy. So just tough it out. And that's what I did. But now there is new evidence saying that maybe it's not such a horrible thing. And maybe I am a candidate for hormone replacement therapy. So that's something we'll probably enter into the conversation as well. It's something I'm just now exploring. But removing the ovaries and the fallopian tubes was a pretty emotional process because, that's closing the door on childbirth, right? At least pregnancy and childbirth. That was saying, okay, we're definitely done. So that's a thing. But also it was freeing because it was a very stressful thing every time I went in for an ultrasound, every time I did my CA-125 test, we're watching my levels, all the things that you do to screen for ovarian cancer, it eliminated that concern. So I was able to breathe a lot easier. And same thing, after the mastectomy. Yes, it was hard, it was difficult, but it was better than getting diagnosed with cancer. So I'm here today, standing strong and proud and still standing. And I think the next post we'll talk about some other things that I'm facing, different health challenges, because I think I've kind of taken you through my BRCA2 process. And it's a continued process, and I will have to replace these implants at some point. Actually was supposed to be meeting with a doctor last week to talk about that, but some other things popped up that need my attention, so we're gonna put that conversation off, and I postponed that for another couple months. And yeah, that's where I sit. So here I am in my happy place out at the barn. Had to come out here to clean up after the storm because my sweet pony had to come into the barn to stay dry. And now I'm gonna go groom her and get a little ride in here today. It's kind of a brisk day, but it's not raining, and you gotta love that. So I don't know if I mentioned this, but this is like definitely my happy place. Anywhere there are horses is where I come. This is where I can like exhale. It's probably the only place I come where I really disconnect, and I clean a stall, and that brings me peace of mind. It's just sort of like meditative for me. All the smells, all the sounds. This is just where I find that I can breathe. So yeah, I'm gonna go hang out with my pony now and just soak up all the things that make me happy, because as a child this is literally what brought me joy, and it never stopped. So horses are my thing. Thank you so much for joining Our Health Inheritance, and I will continue this journey. Again, I hate the word. I will continue my story. I'm trying to really remove the word journey from my vocabulary, but it keeps popping up. But I will talk more next time. So thank you for joining me, and please do like, subscribe, share, all the things. I do have a YouTube channel called Our Health Inheritance. I would love if you went there and subscribed. And then also I have a TikTok, I have an Instagram, and of course the Facebook page, all titled Our Health Inheritance. So thank you so much, and have a wonderful rest of your weekend.